These are basic supplies for care of any wound. It includes a wound cleansing agent. This happens to be SureCleanse. There's a sponge to cleanse the wound, some cotton products, normal saline in a bottle, and some exam gloves. In preparing to cleanse any wound, it is important to protect the bedding, and using 2 chucks as demonstrated here will always benefit you. In the cleansing of a wound, it is always best to cleanse the actual wound itself first. Use the sponge and the SureCleanse. The SureCleanse is placed in the sponge and then used to dab a wound. Scrubbing a wound is often painful, but dabbing a wound is not. In our model, there is no open wound, so scrubbing is done to illustrate the cleansing of the skin. All surfaces of the anatomical area is important to cleanse, not just the wound. The skin surrounding the wound also contains bacteria that can get into the wound. Allowing the bacteria to remain in direct contact with the skin adjacent to an open wound will contribute to an increasing risk of infection. If the wound is located on the bottom of the foot, you need to still cleanse the top of the foot and between the toes. Cleansing all the skin around the wound, regardless of where it's located, is very important. This wound could be located on the fingers, the hand, the elbow, the torso, the head and neck. Cleansing the wound and the skin surrounding the wound is very important. Using a gentle cleansing agent like SureCleanse will contribute to the comfort of the patient. After the wound and the surrounding skin has been cleaned, it's important to remove the lather. This is best done by using saline or bottled water. Pouring the water directly from the bottle will create a mess. You can use the cap to control the flow of water from the bottle. After the wound and the surrounding skin have been rinsed, it is important to dry the area. The 4x4 gauze that have been placed previously are useful for this. Now one is ready to apply the dressing. Removing the upper chuck will allow a dry chuck to be in contact with the anatomical part to be wrapped. It will allow for a dressing to be placed on in a dry way.